Hi, everyone. Welcome back to How Come. Today is Pelvic Pain Day. I'm sitting here with Dr. Tayyaba Ahmed and Dr. Allyson Shrikhande, who are both board-certified doctors of physical medicine and rehabilitation.
So important.
So important. We are so excited for this episode. A lot of you have been asking us about pelvic pain and sending in questions. You've sent in amazing questions. We couldn't be more grateful to our companions. So we're going to ask them to these doctors on this episode. If we don't get to them on this episode, go to patreon.com/howcome. We will have extras and we're going to try to answer everything that you guys have sent us in. Hello. Welcome, ladies.
Hello.
I hate saying ladies. I don't know why I just did that. Welcome, doctors.
Oh, thanks. No, we're so happy to be here.
How come? How come? How come I can't achieve? How come I can't achieve? I'm rolling up my sleeves. I'm rolling up my sleeves. Oh, baby, I believe these guests can help. 'Cause I can't do it by myself. I wanna just...
I'm so happy to have you here. We've talked about pelvic pain a good amount, but you guys do something. I think when we all think of pelvic rehabilitation, a lot of people immediately go to kegels.
Yeah.
And I know that from talking to both of you that is not what you do.
There's like a whole other world besides kegels. And I was literally just telling someone today that like when you think of like the 80s and the 90s, you're like, oh, women's health, kegels, and that's it. And now like there's this whole other world of tight pelvic floor muscles, and those are not kegels.
Okay.
And so that emergence is like slowly starting to rise, but it hasn't had that emergence like the Kegel
movement.
The Kegel movement, exactly.
Yeah.
Yes, the great Kegel rush of 1982.
It was definitely an 80s movement.
Yeah. Okay, so what is pelvic pain?
So pelvic pain, it can come from multiple things, etiologies, but really what we deal with is pelvic pain with muscle spasms. So when their pelvic floor is spastic and tight, there can be a lot of pain with intercourse or just pelvic pain in general.
And this is for vulva-owning people or penis-owning people as well?
It's for everything.
For everyone.
Yeah, when I first started, I had women's health. Come see me if you have, pain with intercourse.
Yeah.
But the men started showing up at the door. And the anatomy is the same from what we do. So we started treating them. So we treat the men and the women.
Everyone has a pelvic floor?
Yep.
Okay, where is that?
It's basically anywhere between the pubic bone and the tailbone. And there's this pelvic floor that holds up your organs. So for females, uterus, for males, prostate, and then the bladder for both, and then the bowel for both. We have to include trans also.
Of course. So it's like kind of like a netting that is holding up.
Like a hammock.
A sling or
And
a hammock.
it's a muscle.
Yeah. It's a muscle.
Okay.
Yeah, exactly.
Okay. And so we've spoken to 3 people now who had vaginismus. Is that related to pelvic pain?
Yes.
Definitely.
Very much so.
Okay. Is vaginismus a spasm?
It's like a contraction of the muscles. Now, sometimes it's happening for the first time ever. So you could have like that 16-year-old girl who gets her period. Well, she probably got her period much earlier, but she probably didn't put a tampon in, or maybe her mom taught her at like 15, 16, and she can't get it in. And that's typically the primary vaginismus, that diagnosis of, okay, she's not able to get it in. Or the first time she meets a guy and she wants to have sex and she can't,
It's a fear of penetration.
Fear of
But the
penetration.
body's fear.
Contracting.
Yeah.
And then there's a secondary vaginismus, which happens sometimes later in life, where you can have great sex your whole life, and then all of a sudden something happened, like hormonally changes, trauma or accident. I had one patient, her husband had died, and years later she didn't do anything, and then now she's having tight muscles, and that's more like secondary vaginismus.
Okay.
And sometimes it's not just their mind's fear. Sometimes there is something underlying that can cause that to happen. So it's not always necessarily just in their, anxiety related. Sometimes there is something gynecological that can stimulate that.
Okay. So what are the kinds of issues when people come to get your care?
Endometriosis is a huge one.
Okay.
I
know because of there's commercials.
Oh yeah, so they're big now. The commercials
Huge.
are out there now, which is great.
Yes.
Because it's 1 in every 10 women.
Is it that
Yeah.
common?
It's pretty common.
That's wild.
Yeah.
And so what is endometriosis?
So endometriosis is endometrial like tissue that's not in the uterus. It's now outside of the uterus. So imagine that pelvis.
Yeah.
And imagine that sling. And then the uterus, the ovaries, the bladder, and the bowel. And now endometriosis can be anywhere in there.
Right. So it's basically outside where it's supposed to be. So it's these endometrial
and it's supposed
tissues.
to be
it's
in
not
the bladder or in the uterus?
No, it's not really supposed to be anywhere.
Oh.
But so it's tissue that's outside. And so when some people who have it, when you have your period, those implants cause pain.
So there are lesions or implants that cause pain and inflammation wherever they are throughout the pelvis.
Like almost the way I have like polyps on my vocal cords. This like endometrial tissue, you're saying?
Yeah, type
it's
tissue.
causing some sort of pain inside.
But there should be no endometrial tissue to begin with.
Well, it's like tissue, but it's not supposed to be hanging out. So in a woman who doesn't have endometriosis, they don't have that hanging around their bladder. And so now a woman with endometriosis might have bladder pain, or she might have bowel pain, or she might have bloating and sometimes it actually goes up to the lungs. So I often say it's like a benign cancer.
Yeah, I was going to
Yes,
say,
it
it
is.
sounds like something that can take over your entire body.
Right. It can even go in the lymph nodes and spread. It's like a cancer, but it's benign.
From what I've read about it, it's really misdiagnosed.
100%. I mean, most patients come being told by multiple doctors, have a glass of wine, you'll be fine, just relax. Because the workup's normal. The MRIs are normal, blood tests are normal. So quite often they're frustrated and misdiagnosed. And at this point, there is no proper diagnosis other than surgery. So, which we have to send to take a look, essentially. So, and we are working on something called the ROSE trial to try and figure out how to diagnose endometriosis through menstrual blood flow, through analyzing biomarkers in the blood flow. So we're hoping to get more patients to help us participate and really, really find a diagnosis.
So is everything that people coming to you for, they get told that it's stress related? Like endometriosis, that's stress related. A tight pelvic floor is stress related,
Yes,
apparently.
totally. Yes.
So like everything's in your head and you're
Yes.
crazy
Right.
from every other doctor.
Right, which is not true.
But how come doctors aren't more educated on this?
Very good question. Unfortunately, there's just not a lot. Even in rehab, we're physiatrists. Even where we trained, there was no training for pelvic pain. I mean, we have to go out and try to get this education on our own.
And how did you both get into the field?
Essentially, I had my own issues postpartum. Had a baby, had some SI joint dysfunction during pregnancy, but then after delivery, had a lot of urinary incontinence, urgency, some pain with intercourse, and sought treatment from pelvic floor PT. And then I created a protocol that was a non-surgical outpatient protocol to treat the pelvic floor muscles and nerves because I needed help and I was trying to treat myself.
Yeah. It just feels like such a chicken or the egg situation where it's like, okay, I have this thing. None of the doctors know about what to do. So then I have to invent this plan of what to do to treat myself that nobody knows what to do.
Well, the pelvic physical therapists have been doing it for a lot longer than the doctors have.
Definitely.
So they've been around. They've been doing it. But there's that whole, are you the weak pelvic floor that needs the kegels or are you the tight pelvic floor that will get worse with kegels? And so everyone is kind of just running to the pelvic PT and they have to be good at what they do to know which one you are.
Yeah. Because you were saying that you're having urinary problems. That seems like a case for kegels to me.
Exactly. That's when it can get a little confusing.
Yeah, okay.
Because when the muscles are in spasm, they're weaker. So they're short, spastic, and weak. So they're also not holding up the bladder very well and also can cause irritation of the bladder neck.
Oh my God.
So, but then also laxity can cause symptoms as well. Laxity means when the muscles are weaker and spread out, not spastic, they're weaker, then you can get some urinary symptoms too. But that's the pelvic floor physical therapists who treat pelvic floor are excellent at kind of guiding you there. And we always start there. If we meet someone and they haven't tried pelvic floor PT, it's always the first place to start.
What is that process like? Because I've been led through the vaginismus thing of going putting the Russian dolls up your vagina. What is the little dildo sizes?
Oh, dilators.
Dilators. Yeah.
Oh.
But for this, is it relax this much for 30 seconds? You know what I mean?
It's really hard because I went after my second And, I noticed that I'm that mom. I was working out and I was leaking, and it wasn't like a ton, but enough that I was like, I don't want to leak anymore. So I went to pelvic PT. They did an exam. They went in. They saw I had someone that I trusted, do the exam. And she taught me some exercises. And within 2 weeks, I noticed a serious improvement in my leakage. But you do have to keep it up. Now, if you want it to keep it going, there are surgical procedures to do.
Yeah.
That could potentially help, but I didn't feel like I wanted to do a surgical procedure. I feel like conservative treatment was good for me.
Yeah.
And I do have to keep it up. But I've also heard of patients who've had surgeries and they were told to do kegels, and they did 300 kegels every day for 6 months, and then they ended up being the tight pelvic floor. So you don't want to be on either extreme.
Yeah. And so you probably should have a doctor or specialist watching
managing,
you. Yeah. Don't just go out there and go do your own exercises and try to fix.
Yeah. Because then you're in a bit of a hot mess now trying to reverse stuff. And reversing a hypertonic, tight pelvic floor, you have to get back to the loose and then strengthening. So
Strengthening back up again.
Without getting tight.
It's like your pelvic floor is like a really intense actor that just gets skinny and fat for different roles. It's like my pelvic floor is Daniel Day-Lewis, actually. Well, mine is Christian Bale.
Oh my God, Christian Bale.
What is that process like?
Yeah. What are those different exercises?
Well, some are just different ways to do kegels. So you know how you use ankle weights for strengthening your legs, or some of them are doing them with resistance. And sometimes I'm sure you've seen the Kegel balls, and some people who like to use tools will say, we'll do it with a Kegel ball now, and here's an extra weight, a 2-pound weight, or you don't want to do anything crazy. I've seen some crazy Facebook that woman who was on the beach.
Oh yeah, who can lift
lifting a weight.
We do not recommend that.
Don't do that.
It looks cool to me.
It looks
So
cool,
funny.
but I would not want to be her bladder.
Those can help an over tightened one?
No.
I
mean,
okay.
Yeah. First, you have to kind of make it a little looser, and then you can tighten.
How would you make it looser?
So we do a lot of different things. I mean, we do medication management with it's going to be crazy, but Valium suppositories is an option, and it is what it
Up the
sounds
butt?
like.
Or vaginal.
Or vagina.
Oh,
Either
and
one.
a suppository is just in
Anywhere.
Anywhere, any hole. Just not
but
your
not your
mouth.
mouth.
Just not your mouth or your ears or your nose. Yeah. I had a patient yesterday who was like, I don't put anything anywhere, including my nose or my mouth. I was like, okay, interesting. Food goes in there.
Yeah.
Yeah.
Interesting.
You're a liar.
How did you survive for so long?
But yeah, so you could put vaginal, and you've probably, in LA they have THC suppositories now. They also have CBD suppositories. So for people who are against medication,
So it literally just gets right to the area,
Right.
and kind of
it's a problem.
mellows it out.
Gets to the source,
Wow.
Exactly.
That's brilliant.
right?
Yeah, it's like a CBD tampon.
Exactly.
Yeah, that's exactly right. I've heard that.
It's funny though, because you get it. It makes so much sense.
Totally.
But so many GYNs don't get it. Have never heard of it, and they're just scared to prescribe something they don't know.
Yeah, totally.
Yeah, but it works. It definitely
Really
works.
well. I used one last night. Not even kidding.
I went right to sleep. No.
It really helps sleep too.
But it doesn't affect...
Well, there is some systemic absorption. But it's not nearly what a pill would be.
Right.
But there is some.
But
so we
it's-
always have to.
Sure, of
Rectally, especially. Rectally.
Yeah.
I heard that. That's with not that people should do this, but people were doing alcoholic soaked
Oh, well.
tampons and stuff and putting it up their butts.
Right.
Because
Yeah.
it
Yeah,
gets
to get
to
high,
your
it's
bloodstream
faster.
faster.
Yeah.
Yeah.
Increase blood
Dangerous.
supply.
Don't do that.
No.
Yeah. No, this is
But
not like
putting-
that.
Yeah.
Nope.
No.
You're not that
Don't-
kind of doctor.
Don't do that. But CBD, A-okay. Or
Yeah.
prescribed by a doctor, even better.
Yeah.
One of our listeners wrote in, just because you were saying that you were an exercising mom. A lot of women after giving birth get pelvic floor disorder, and then their doctor tells them they shouldn't exercise at all, which is obviously really limiting. But the catch is that there's basically no research into exercises that women can and can't do to protect pelvic floor stuff.
Yeah, there is definitely a lack of research out there. What we normally use is called Your Pace Yoga. Dusty and Miller, Her Your Pace yoga is fabulous. She was used to be a pelvic floor PT, and then she created this yoga program to kind of help both strengthen and get that neuromuscular re-education and keep the pelvis open at the same time. And there's different stages. You can get a little cardio in there too if you want, but it's pretty amazing.
So it's like you're doing a full body exercise to target one area.
Exactly.
I like that.
And there's a lot of breathing and meditation in it, which is it's pretty great.
Cool.
I think we do a lot of like what you can do and what you can't do. It kind of makes sense to us, but maybe we'll ask you, does it make sense to spin if your pelvic floor hurts?
No, it does not make sense to spin ever.
Good, me too. I hate spinning.
I'm tired. But no, that makes sense.
Yeah, like would running really work on your pelvic floor and you're leaking?
No.
Probably
But what
not.
about an elliptical?
Yeah.
That's fine.
More
10,
ease.
15, 20 minutes at a time, not so bad.
What about sex?
Well, that's what we do for a living. We get people having sex.
Yeah.
We're killing for
We
sex.
can't tell you to stop having sex.
Right.
That's why you're coming.
That's
to
our
us.
goal.
Yeah.
We high five when that happens.
Yeah. It's good cardio.
No, but I mean, there's different, I guess, thought processes here. But overall, it's not dangerous to have sex if there's any pelvic floor hypertonia or dysfunction. The main concern is you don't want a negative association with having sex.
We
just don't want to reinforce that negativity. So sometimes we'll say, hold off, just chill out for a bit, and we'll get you going when we feel you're ready.
Totally.
But it's just for that. We just don't want that negative association.
Yeah. Most people are coming in because it's sex related, or they're just
definitely.
uncomfortable and leaking.
Definitely.
Okay.
Oh, no,
Mostly
most
sex.
people-
No. Leaking
Pain.
is like, it's sex.
It's sex, yeah.
That's the driver.
Pain with intercourse.
Don't you think that's? I mean, this is a little psyche, but like leaking is an issue for yourself. But until it becomes a problem with someone else and maybe like their sexual life, nobody takes.
Well, that's the thing. I tell patients, you take care of your pelvic floor now, you won't be in depends when you're in your 70s.
Yeah.
But everyone's too focused on having good sex in their 20s that they're not really so concerned with the other stuff in their 70s.
So the leaking can happen later in life because of bad pelvic floor maintenance now.
Well, if you're really weak and I'll do exams on some girls who are like in their 20s or 30s and they're really weak now. I mean, it's not going to get much better.
Okay.
I mean, unless they do something. But most of them are in therapy, and so they're doing really well.
Yeah. Does squirting have anything to do with leaking?
Control. It does have to do with your ability to control your pelvic floor is how I would look at it. Yeah. So it does. And the higher level control, then your abilities will improve.
Okay.
Yeah.
Cool. Okay, so then just back to endometriosis for a second. This girl said, I just had a laparoscopy to get it. Am I saying that right? Mm-hmm. Laparoscopy to get it removed, and I'm still having pain. Is that normal?
Yeah. Well, come see us. Yes.
Okay.
I mean, it is because we treat the nerves and the muscles associated with the pelvis, and the nerve and muscle issues have been going on for so long because they don't like the presence of the endo in your body.
Yeah.
They go into this chronic kind of guarding state. And even if you have that endo removed, which is the primary pain generator, you still have to help the muscles and the nerves along.
Because they're like having PTSD,
Yeah.
kind
Yeah.
of.
Still in
It's
that
like
state.
they've been intimidated for
Right.
such a long time by this
Exactly.
new person.
Exactly.
Creep.
Totally.
Or lack thereum. Now there's no creep in there.
Now there's no creep, and they're
nothing in here.
like, I got so accustomed to this creep. This one listener says she has sex pain because of endometriosis. Are there positions or things to do to inhibit pain?
Yeah, we always talk about positions with our patients. So if someone says it's uncomfortable, we say, is it all positions? And we try and figure out what's not uncomfortable. And then
So it's like
go with
take an
that.
inventory of yourself because
Yeah.
your body's probably constructed differently, and you don't know
Yeah.
where
And
your
also-
endometriosis is.
Is
Exactly.
it
Yeah.
entrance pain? Is it thrusting
Yeah.
pain? It's not all the same.
No.
Sometimes it's just getting in.
Totally.
And then sometimes it's the right, sometimes it's the left, and, kind of getting angled.
Yeah.
Can a papillomavirus cause pelvic pain?
I mean,
Like
I
an
guess
HPV? Or?
technically anything in your bowel, your bladder, and your gynecologic system could cause pelvic pain.
Interesting.
Anything that's basically anything that's down there can cause those muscles to be tight.
Okay.
If you've had any procedures down there, I mean, male or female, any procedures, like you could have an IUD placed and have pelvic pain. You could have a labiosurgery, just a cosmetic surgery, and have pelvic pain after.
I had really intense pain after my IUD was implanted, but I think it was like pretty normal. I mean, I hate to say that that's normal, but they were like, yeah, you're going to have the worst cramps ever and bleed for a month. And I wore one of those diapers.
I know. It's wild though. Like, so up until this point, basically women have to get to like that stage 3 you were saying of like, I am in so much pain. I know for a fact something is wrong. And like kind of push aside all the doctors who are like, oh, it's in your head or it's cramps or something.
Yeah, unfortunately.
Well, at this point, we're trying to raise awareness, and there's a lot of programs. I know Shannon Cohen from EndoWatt is doing a program where she's getting a kit into nurses' offices for high schools to try and teach kids, this is a normal period. This is definitely not normal. So I think the whole goal is to educate younger and younger so that people won't be a decade of symptoms.
Totally. This listener said, I had pelvic pain when I changed partners. Now I don't with him after many years. Is that normal?
She's gotten used to him.
Yeah. I think maybe she just got used to him and what you were saying, found
size.
their positions.
Yeah.
This listener said, is it weird every time I climax, the next day I get a UTI/have UTI symptoms? Do you guys cover UTIs?
A lot of times it's not actually a UTI and it feels like a UTI. So a lot of people are like, oh, I had a UTI. And then they go to their urgent care, CityMD, and they get their urine tested and it's clean. But then they're like, oh, but it's probably a positive culture. So we'll give you some antibiotics. And then it comes out negative. And so they think they've had this UTI that they've been treated, but they never found out their culture results. And so they're saying they have these UTI type symptoms, but really it's just pelvic floor dysfunction. Right. And that's why they end up with us. So they've done these rounds of antibiotics and they're like, my UTI, like I've been on a month of antibiotics. How come my UTI is not going away?
That makes sense. Yeah. One of my friends said for like 6 months, she kept getting diagnosed with UTIs and it was all pelvic floor related.
Yeah.
So should people be going to both an OBGYN and a pelvic floor specialist?
Well, so what we do is so rare that there's barely 5 of us in New York City who are doing this. And
That's
so
insane.
And we're not GYNs or therapists. We're like the random physiatrists in New York doing it.
Okay.
So yeah, if they want to start off with a pelvic physical therapist, I think they might have better luck getting to a proper diagnosis because the pelvic physical therapists have been doing it longer than a lot of the GYNs.
Okay.
Right.
But this question was specifically about having an orgasm that the next day she has symptoms. Is that something you've ever heard of before?
So orgasms involve the pelvic floor muscles and nerves.
Yeah.
And the pudendal nerve.
Okay.
So we hear that all the time. I had a flare after my orgasm, post-orgasm flare.
Okay.
And their flare feels like a UTI. So people even come to us, what's your main complaint to me? I feel like I have a constant UTI. Or I feel like I have a yeast infection. But they're negative cultures. Everything's clean. So it's just pelvic floor
So
pain.
like
but
orgasm
you get
is
a nice
contracting.
orgasm and then you have a horrible feeling right after.
Yes.
Because when you're tight,
Yeah.
and then you're trying to get what is orgasm?
A contraction.
A contraction.
Yeah.
So it's like, but I forget how many contractions in like 8 seconds or something crazy. But now if you're loose and then you have a contraction like an orgasm, it's like it feels better, right? So when you're tight, you don't feel that great going into a tighter state.
Totally.
Does that make sense?
Yes, definitely.
So now you flared yourself.
Yeah. Oh.
So what do you do in that case?
You come to us.
Yeah, we treat you. Yeah, but it's the idea of down regulating basically your peripheral and central nerves. Calm them down. We try to chill them out. We try to create more space in your pelvis, open up the muscles with the pelvic floor PT. But that's how you get better. We calm it all down, chill it all out.
Yeah, because no one's like, I need to stop orgasming.
No.
That is not the solution.
We can't tell people to stop doing that.
No, definitely not.
We had one listener who said, before I was diagnosed with hyperactive pelvic floor, I had gynecologists telling me it was yeast infections or I was just like that for 6 months. I honestly thought my body was broken until I finally saw a doctor who knew what was going on. Luckily, after much PT and dilators, I'm doing much better. But along with that, I've also realized I'm someone who will always have pelvic pain. And instead of trying to do a quick fix, how to do long-term maintenance and how to have pleasurable sex.
So there are other things she can add in, because it sounds like she's not, I mean, what she's done so far is basically the tip of what we do. I mean, we do nerve block injections to the pelvic floor, and a lot of our patients will say like one PT session, one injection is like equivalent to like 5 or 6 PT sessions. So she could do more. Yeah. And then sometimes it's like those maintenance of those injections that actually keep patients better for longer. Or, you know, there are the Valium suppositories I mentioned that, that they can use like right before intercourse. There's other things. I mean, and then sometimes there's nerve medications that can kind of calm down the nerves.
But is it kind of like living as an alcoholic? Like you're always recovering?
It depends on the underlying cause. So every patient's so different. So some no. Yeah. And some yes.
Like the endo patients, it's a chronic disease.
Is it? And it'll probably grow back as well, or?
The recurrence rates are quoted in the data post-operatively are between 7 to 10%.
Okay.
If they have a good endometriosis excision. But if they have an ablation, which is just burning it, I don't know what the rates are. Is it the same recurrence rate? Probably not. It's probably more.
All right, you guys. So we're going to take a wee little break because Nanny just got home and she wants to meet these doctors. So while Charlotte introduces them to her, I'm going to talk to you about my Helix mattress. You guys know I love it. Now it has the love of my friend Lily. I don't know if you guys know about my other podcast, We Really Love Island. Basically, I just binged this show, Love Island, with my other comedian friends. It's a British reality show, blah, 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 and then we recap it. But last night we were doing that. It was the first time Lily had slept over while I had my Helix mattress. And she was like, Remy, that was the best night's sleep of my life. Neither of us moved. Neither of us hit each other. It was just the best. So if you want a Helix mattress, you should get one right now at helixsleep.com/howcome. It is the best mattress for sleeping. It is the best mattress for sex. How do you know it's going to align with your body? Because they have a 2-minute sleep quiz online that matches you to your perfect mattress based on your body type and your sleep preference. If you're in a couple, it matches you and your partner with a mattress that's good, split down the middle for their preference and yours. Amazing. Like I said, Lily is very tough to please. One time she spent Christmas with me and we had Chinese food and she said, this is the worst Christmas of my life. But it was a great Christmas, and she loves the Helix mattress, and so do I, and you guys will too. Again, go to helixsleep.com/howcome for up to $125 off of any mattress order. That is right, up to $125 off of any order. That's amazing. And what's even more amazing is that since you already love this podcast and you want to help us so badly, by getting your own mattress, we get a little percentage of that mattress. Whoa. So even if you're not a Patreon patron and you're not supporting us by liking, rating, or reviewing, which you should, you can get a mattress totally selfishly and still help us. Again, that is helixsleep.com/howcome for up to $125 off of any order. Oh, and they're back. All right, I guess they didn't talk for a long time. Come back, ladies. Talk to me. Why did I say ladies again? Jesus Christ.
What kinds of things do guys feel when they come in with these issues, or people with penises?
Guys are the most interesting because their issues are usually all sexual, unless it's like a little bit urinary. But usually it's post-ejaculation pain, and they feel it in the perineum. So it's like between the area between their penis and their rectum. So the post-perineal pain or post-ejaculation pain, sometimes during ejaculation, and sometimes they come in with tip of the penis pain, sometimes the shaft pain, sometimes it's their testicles that actually hurt.
And that all counts as pelvis.
All pelvis. All pelvis. It's all our realm.
And that's when it's too tight.
Yeah, yes. And sometimes there's injuries, sex injuries that can occur. They're worried it's been fractured, or they read something in Men's Health and that told them to do these kegels during ejaculation, and they kept doing it. And
they didn't realize they were already tight. Yeah.
Yeah, exactly.
Or they're doing it on purpose because like they were told that they're going to get better at sex if they do like 500 kegels.
Right. So
the pelvis seems like a very inclusive organ.
Welcoming to all.
Does not discriminate.
What are like the most extreme cases that have come in to you?
Of pelvic pain?
Yeah.
Endo is definitely the hardest.
Okay.
I think, in my opinion,
Yeah.
just because it's chronic.
Yeah.
Getting them in and kind of like getting them through the surgeries and, after post surgeries, it's always nice to see when a patient's doing well, because it's so hard to like, I don't have endo, so I don't, to see someone suffering every single day is really tough.
Yeah, of course.
Yeah, I think some of the more challenging cases too are, in my suspicion, maybe missed endo. By the time they get to us, they're postmenopausal. So it's not really an option to have a resection at that point. So they've had this centralized nerve pain for 20 plus years, sometimes 25, 30 years. It's really affected their life, and they can be really challenging to explain why they're in pain and try and get them better, just because it's been going on for so long. Yeah. So our whole thing is to try and raise awareness and get people early.
Get them early.
We can get you better if we get you early, but
totally.
After a long time, it's very much a challenge.
Damn.
Yeah,
that sucks.
That's tough.
Yeah. Well, another one that's really bad, thinking about it, is the ones with the pudendal nerve, like that have had pudendal entrapment.
What is that?
There's a major nerve of the pelvis, basically, and it's kind of affected with scar tissue, and sometimes it can be entrapped, and then it causes a lot of sitting pain. And so a lot of these patients, men and women, are really hard to treat too, because they have a lot of pain, and it could be with anyone. You could have endo and have this, or it could be anyone, and that's really tough to treat too, because a lot of people sit all day, right, for their job. So now they are limited because they can barely sit. So a lot of them have to go on disability, or they can't work. And if walking around with donut pillows, cushions.
We had a family member that was sitting on a donut for a while.
Yeah.
And it was pretty tough. Yeah, because there's not just that I'm taking care of my body, but I can't really go in public because I don't want to be bringing this donut out, and I feel embarrassed and
taking it to restaurants,
exactly.
on planes.
Everybody's going to be asking, "What's wrong with your ass? What's wrong with you?"
Totally, yeah.
But you know what? A lot of times these like eye bankers, lawyers, doctors, like we get a lot of really like smart people, and it's not like it has anything to do with like being a truck driver or anything. This is just like people who sit for work. And so it's nothing to be embarrassed of, but everyone's so embarrassed about it, and that kind of sucks.
Do you get a lot of truck drivers?
I have a couple.
They've got like long commutes. We got a lot of truck driver listeners because podcasts are very popular with road trips.
Are you guys saying that sitting can induce these issues, or just exacerbates them?
Exacerbate.
Okay.
Yeah, it's an exacerbation. It's putting pressure, so that pudendal nerve goes right under your sit bone. So, and nerves love blood flow, right? And so when you're sitting for a long period of time, there's like what we call neural ischemia. So the blood flow can't get to those nerves as well. So it just exacerbates it.
That's why we love yoga, because they get the blood to where it needs to get.
I always like a nice marriage of Eastern and Western medicine.
Yes, we do
A little something from everyone.
Yeah.
Were you afraid to... Did you have a second child after your first?
I had one, but 7 years later.
So I was going to say, did you have like
Just now, I have a 1-year-old baby now.
Oh my God, congrats.
Yeah. But yes, I was super afraid.
Yeah, I was going to say, I feel like putting your body through that, and like pregnancy is tough enough, and then something after pregnancy would kind of make you not want to put yourself through that again.
Yeah, it's funny, but then you forget, a little bit, because with time you get a little bit better.
Yeah. And then you're like, oh my God, how did I end up here again?
Yes.
Was it okay, the second pregnancy?
No, not at all.
No, okay. Oh,
no. Not at all. But, I have a great pelvic floor PT, and Ty and Charity treat me in the office with the protocol. So I'm dealing with it. But no, it wasn't pretty.
But I think it's great that you experience it yourself, because you know exactly what people are going through.
Exactly. Yes, definitely. I have my own dilator. Yeah. I have my work to do at home. Yeah. And I understand. When people are telling me their symptoms, I'm like, I totally get it. Yes.
And were you already practicing during your first pregnancy?
No, I was. Okay. We were in residency together.
Okay.
So I was a final year resident during my first pregnancy.
Damn, that's busy and tiring.
Yes, good time.
I would kill myself.
Yeah, why didn't we kill ourselves? I had my first one then too.
Oh my God,
you did the same thing.
So many hours on swollen feet.
Yeah, well, I don't remember that, but Yeah, I guess we were pretty big at the end.
Yes.
But yeah, I went back to work at 6 weeks.
Yeah.
So I
me
could
too.
graduate on time. I graduated 2 days late.
Whoa.
Yeah.
Yeah.
You guys, women have it so easy. I don't know what people are saying. But when you were in residency, did you know about what you would what would end up happening to your body?
Not at all.
Okay.
Yeah, I
No.
was totally naive and oblivious.
Oh God.
So
Yeah.
not at all.
Like
You
most
would think I
people,
would've known more.
most people would do like Lamaze classes and all
Yeah.
that. You hear these things,
Yeah.
but like you're like, oh, I went to med school. I did an OB rotation.
Exactly.
Yeah.
I don't need to watch. I didn't watch anything.
I know, me too.
I should have watched a YouTube video. Like not even a YouTube video.
I know.
My
I
husband-
think a lot of
yeah.
people try to avoid it because they're like, I'm already this far. Like, I can't go back.
No.
I can't tell it to stay inside.
Yeah.
Like, if I get afraid from a
Yeah.
video. That's so scary, though. And then, you have to take care of your kid, new baby, while dealing with all this pain.
Yeah.
Yeah, no, yeah. But luckily I had a great babysitter and
Okay.
support from my husband. But
That's good.
yeah, but that is...
Yeah.
I know. It's hard for the women we see postpartum because
Yeah.
sometimes they'll bring their baby to the appointment. It's, they're breastfeeding and even to get to their PTs. But a lot of the pelvic floor PTs are totally used to this. And if your baby's taking a nap, they'll treat you, you
Yeah.
know.
Yeah.
So they're used to it.
Teamwork.
Yeah. That's
Teamwork.
that's a third one I think that's hard to treat. The postpartum.
Yeah.
The postpartum when there's like a lot of injury and the nerves are irritated and I have one I have a person that has like no clitoral sensation and that's really tough.
Is that a new thing or?
Yeah.
No, it was
How'd that
postpartum,
Wow.
Because the pudendal nerve gets
Just
smashed sometimes.
but it's only on the right side, which is really sad. Well, I mean, I guess it's better than having it on both sides, but because each of the nerves are on each side.
Okay.
It's not like one nerve does everything. It's like you have right side and a left side.
But I'm picturing like the Titanic smashing into an iceberg and the clit is the iceberg. Is that iceberg forever injured?
Well, actually, that's the amazing thing. Like
Okay.
It took about a year and a half before she even found us. But then once we did, now we're like maybe a year and almost a half getting in, or like a year, and we're getting sensation back.
Oh,
Which is like
So exciting.
hooray!
Yeah, hooray. Major hooray. I would be
Major
so depressed.
Yeah.
I guess this is just how depressed would Remy get with more vaginal issues.
No, nerves can heal. They
Yeah.
heal, they regenerate. So
Okay.
our whole thought process of what we do is we're not actually healing the nerves. We're just creating a better environment so that they can heal themselves.
Yeah.
But they do heal. So that's why it's great.
Yeah.
So that's like how we're rehab doctors. We're all about rehabbing.
Yeah.
Yes.
Yeah. So like making people better.
Totally. Does anybody ever come in with issues that they can't orgasm?
Anorgasmia, yeah.
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 And is that something you guys treat as well?
Yeah.
Yeah, we
Oh.
treat it. We don't claim to treat it, but we see it so much and what we do seems to help it.
Okay.
So sometimes we're like, sure, let's try and do this.
I was
You know?
gonna
We don't
say.
like claim with pain. We're like, we know we can we can swing that pendulum. But the anorgasmia, it's a little
Yeah.
less known, but we see the progress anecdotally, so we always try.
Totally. I was
Yeah.
going to say too, though, because a lot of people that have come to us or talked to us, a lot of their orgasms and even my anorgasmia, I think, had to do with like being kind of locked
Clenched
up
and-
and
yeah.
clenched and nervous, you know, and just kind of not letting go and not being able to relax.
Yeah.
And it sounds like a lot of what you do is just you make it
Everyone relax.
easier to
Yeah.
relax.
Yeah.
Yeah.
So anorgasmia, it obviously just means no orgasm.
No orgasm.
Yeah.
Yeah.
But for me, that sounds so permanent when someone could think they're anorgasmic and don't have them just because they haven't yet.
Right.
Well, it's
Right?
harder.
That's
Like-
what I thought about
It-
me.
Exactly.
Yeah.
It's like,
you never had, well, I don't know if it's too personal, but you never had one and then, or you had one and then you didn't?
No, I never had one until I started this podcast.
Okay. So
Yeah.
it's harder to treat someone for anorgasmia if they've never had one. So yay for you.
Yay me.
But if they've had one
Yeah.
and then they didn't,
That's
It's-
more rehab. That's
yeah,
let's
we
get
can,
back to
yeah,
normal.
We
where-
can actually get you, you know, we're more confident. And if you
Yeah.
haven't, hey, why not try what we're doing?
Totally. One of our listeners wrote, I've had reoccurring thrush for years. Is there a cure? cure. I don't even know what thrush is. Do you?
So they've had vaginal thrush? And
I
it's
guess.
a yeast.
It's a yeast.
Yeah. So it can...
Happy Passover.
So yeast,
Cure.
I mean,
Low sugar diet.
Yeah.
Yeast love sugar. So
Oh.
we always say...
I'm yeast.
Yeah. So I don't know if there's a cure, but low sugar
Low sugar
diet. Make sure to keep your immune system healthy because it can come when their immune system's down.
Okay.
Any other?
I don't know if this applies, but you guys cover penises as well. And there was a listener who wrote us that her boyfriend gets penis burn every time they have sex. Is that something that you have ever
yeah,
come
that sounds like
across?
what we.
Yes,
That sounds
that's
like
what
what
we
we see.
Really?
What's
Yeah.
penis burn? Like rug burn?
Yeah.
Well, yeah, I mean that's probably how he's saying it, but if we got him to say it, he might say that it was tingling or burning or a sensation of it being at the tip. Most of the time when I talk to any patient, I'll ask like, is it at the tip? Is it at the shaft? Is it at the base?
It's on the side of the shaft.
Yeah, it sounds like our patient.
Yes.
Okay.
That's what we do.
Yeah.
Okay, so if you are listening, get your boyfriend to a pelvic PT.
Well,
'Cause-
somewhere,
or-
wherever you are. Yeah.
And or a doctor, like
Yeah,
wherever
pelvic,
you are.
someone.
Yeah, pelvic doctor, pelvic PT, someone.
Yeah.
But this is something that I've been trying to talk to them, and I'm like, try another position. I don't know. And I can't, I'm like, going from the other side. I don't know.
Because
go to a doctor.
the nerves of the pudendal nerve, they run. So there's like the dorsal nerve of the penis. So that's involved.
So you just need to release sometimes internally and externally around the nerve so it can flow better and then the burning can get better.
Okay.
So they're going to be pelvic floor PTs. We'll do something called nerve gliding or myofascial release and just create space for the nerve that goes to the penis so that it can be happier essentially and not be firing when it shouldn't be.
It's hard to get men to go to PTs.
I'm sure.
Well, when the men who do come to you is it because they found you through other people or they searched you themselves?
Both.
Yeah,
Both.
both. Referring other doctors will send.
Sometimes PT send when they're like kind of patients plateauing, not really making much more improvement, or they want us to help and make things move faster. With some of the stuff that we were doing, we talked about the injections or Valium. They'll say, can you go and see this doctor, and it'll help us.
Yeah.
It'll help us help you get better faster, and so they'll come to us then.
Do you know why there's more reticence for guys to come in? Is it like seen as like a female issue?
I think so. I mean, I think it's maybe they're just embarrassed to have it. But we like to say, honestly, though, the men who get pelvic pain are athletic. They're athletes. It's always their athletes. Yeah. If you have it, it means you're athletic.
There's not a lot of male pelvic PTs in New York City. And so most of the patients who go, I asked a patient, and I said, would you be more comfortable if I was a man? And they said, no. Be okay with female or a man. They're okay.
Yeah.
They seem to be okay. And once they get to PT, they're usually fine. But when you have to explain what PT is, that's when they're like, wait, someone might stick their finger in my butt on a regular. Not sure.
Yeah.
So it's kind of
Invasive.
yeah.
For them.
Yes.
I see.
Yeah. And honestly, it's invasive for a woman too. It's,
Totally.
But I think.
But if it's in the interest of bettering your life and eliminating pain, like I don't know if you guys know this, but in the first season of this podcast, I had assignments to make me be able to have an orgasm. And one of the assignments last season was have a tantric massage. And I always bring that up because it was just this moment of feeling like my whole body was one body and that my vagina, my vulva, my butthole, all of it is just part of my body instead of this is an isolated thing of someone sticking their fingers up your butt or looking at you or whatever. It's like, no, this is a professional who's looking at my body and dissecting it from a medical perspective to make me better as a whole.
Yeah.
And I think that can relieve a lot of stress from the brain and emotionally as well.
Yeah.
Usually when I see a guy and in the beginning they're kind of like, should I have my underwear off? Are you okay? Or do you want me to keep it on? And I'm like, no. no, it's totally normal.
Yeah.
This is what I'm going to do. And at the end, they're usually thanking me. Thanks for all the, I appreciate it, going into detail. Like, they're really grateful. I mean, I know in the beginning, same thing. They love their PTs by the end of it.
Mm-hmm.
They're so grateful.
Totally.
But it is tough finding, I know for myself, that whole mind-body connection to the pelvic floor, because you can't see it. You can tell you contract your bicep, and it's obvious. Like, let's say contract that, and you're like, no, I am. Even myself, I'm like, I am. Why is that biofeedback not moving?
Well, and we never learn about it. Like the way that, like, I was just like, where is the pelvic floor? Like, it's not like in biology class where it's like, that's the diaphragm, those are the lungs.
Right.
Charlotte and I were at a lunch this week, and we had a little model of the clitoris on the table. At the internal structure, obviously, and
What kind of lunch was this?
I know.
and, one
Why are we invited?
for the podcast.
I know. Seriously.
Next time you will be invited. But we were talking about it, and a lot of people had been like, not the ones at the lunch, but people before had been like, well, why do you need to know the internal structure of a
Yeah, you
clitoris?
can't see it.
You can't see it. It's like, well, we all know what our heart is shaped like because of biology class, and you never see that either. We all know what our lungs are shaped. Why aren't we taught about the internal clitoris? Why aren't we taught about the pelvic floor? These are things that are
So important.
so important and very much part of.
I had one time someone asked me, like, could you look at my clitoris? It doesn't look right. And it was stuck.
What?
Couldn't, it was like stuck. It was like an adhesion.
Oh.
So when there's an adhesion, it was literally like stuck with the hood on top. So,
So you had to pull the hood back.
well, it's
Or
not
no.
that easy.
Oh.
It takes a little bit of working on. So that's what that patient's homework is. So, but she
How
had no
stuck,
idea, though, that was like what a clitoris looked like. And she had only seen her own.
Yeah.
But it's not what it looks like, right? If there's an
Well,
adhesion.
no. Well, that's why she thought it was normal.
Oh, okay. Yeah, she was
So
like,
for her whole life. So,
Yeah.
that's the thing. Like, nobody really is looking at anyone else's clitorises.
and they should. We should more. Like, literally, though, guys compare their dicks all the time in locker rooms. It's like not a thing. Or at camp or whatever, like just showing this is what my little campers when I was a counselor would be like, hey Remy, look what I got. I'd be like, don't show me that, but show your friends if you guys want to compare notes. For some reason girls weren't looking as much.
It was a very like shameful thing,
Right.
Yeah.
hiding and.
I have one friend, Erica. We showed each other when we were 4. We said, I have this. Do you have this? And then we said yes. But then we shamefully moved on with the rest of our lives.
Yeah.
No, it's true. I mean, we need to break the barriers because so many people come, oh, I've been living with this for years, but I was embarrassed to tell you about it. Like, it's not embarrassing. It's normal. Everyone has a right to have good intercourse. Like, you should be able to tell your doctor and you should be able to get help.
Were you guys clitorate from a young age?
No.
No.
But I write about it now
Okay.
for the South Asian community because I feel like we have a very, very and a huge taboo with it. So I write about it now I tell my daughters know about
And
their
that's where
vaginas.
your family is from.
Yeah.
Yeah. Okay.
So my 5-year-old knows about her vagina.
Good.
And
Does she have a special word for it, or she calls it vagina?
No, she calls it vagina, but she will ask my husband why he has a long vagina. Like, how come he doesn't have? He has a long one. I'm
She's like, I want a long one.
He should totally just be called that. Long vaginas. Penises.
Well, Charlotte's got like, we were talking about how she gets strep a lot, and I was looking at her uvula, and I was like, ugh, I wish my clitoris looked like a uvula. Like, that would just make so much more sense, like a little door knocker hanging over your vulva.
It should. It would. It makes sense.
But it's also great the way it is. I heard that hyenas give birth out of their clitorises. Did you guys know that? I read that this week.
I
Did not know that.
Isn't that wild? See?
Is that true?
It's true. It's on Wikipedia, at least.
Oh, God.
Charlotte, fact check
I'm
it.
going to fact check.
Okay.
this. But yeah, when did you guys like start?
Yeah,
to-
do you remember first orgasm
Yeah.
experiences?
Oh, gosh. Yeah, I'm still working on it.
Really?
No. About perfecting it. Yeah.
Oh,
Yeah,
okay.
Yeah.
But-
I mean, my first orgasm, yeah, definitely recent, not that long ago.
Wow.
Yeah. So postpartum.
Wow.
Yeah.
Okay, so even professionals, you guys.
Yeah.
That's cool.
That's amazing.
Was it through PT then? Or kind of
Yeah,
just
PT and
exercise?
just more mind body
Mhm.
stuff, figuring it out.
Toys or no?
No toys. No.
Cool.
No toys. Yeah.
Sick. Was it alone? Partnered?
Partnered.
So
Had a little
sweet.
help. My husband, yeah.
Oh, I was thinking your baby. No, I'm just just came out and said, Mom, I'll give you a little hand. And was yours pre-baby?
I think it just gets better and better now that I'm older and more demanding.
Yeah.
I think as I get older, I'm like, oh, this is how this is going to go.
Yeah.
I think when you're younger, I've been married for a really long time, and doesn't really even. I think it's really just being. I don't know. It's the feminist in me now that's taking control.
100%. Charlotte and I always say, if you can speak up in the bedroom, you can speak up better in the boardroom.
Yeah.
Like, it's just taking more control over your life.
Yeah.
Yeah.
But you grew up in a Southeast Asian household. Did they speak about sex at all? No.
My period talk was by my aunt, and my aunt asked me if I knew what a period was, and I pretended like I had no idea, even though I probably already knew. And I said, "You mean like exclamation point, punctuation? What are you talking?" Just to
Trying
like
to be funny.
dodge the conversation. And then I got my period in 6th grade, and my mom gave me some pads, and that was it.
No sex talks.
Oh no.
How'd you learn about sex?
By myself? I don't think there was like a talk. Nobody gave me a talk.
And
there's no
like,
talk.
masturbation exploration, or
There's no like, I was dating,
okay,
kind of just on my own, but it wasn't really like nobody gives talks. And just culture and religious backgrounds, like there's no talking about that stuff.
Totally. And how do they feel about you treating such a sexually
So it's funny
linked
now
thing?
because my mom will be like so proud of me, and we'll be at Thanksgiving, and all these like random uncles will be around, and she'll be like, "Oh, Google her," and I'm like, "Mom, please don't tell them to Google me. You don't know what you're gonna find."
Yeah.
I was like, I end up getting the male sex topics every time we do any of these things.
Yeah.
So I was like, they can look me up, that's fine, but you just be careful. And she's like, "Oh my God, wait, you should stop treating men." And I'm like, "Mom, stop. Like, I'm not going to stop treating men."
Right. No, because they need it too.
Yeah.
And how does your dad feel?
I'd never had the conversation with him.
Really?
Yeah, he's like 70 almost. He doesn't need to. It's fine.
But you're doing such good.
Yeah. But, yeah, you get to
The most good.
The most good. Yeah.
It's all right. He's like, "So how's work?" I'm like, "Great."
It's work. And what about yours? Are they proud?
Are they proud? I think they're proud. I'm not sure. They're still trying to. It's a new field.
Okay.
Everyone's trying to understand what we really do.
Yeah.
Even other physicians are like, "What do you do?"
Totally. Yeah.
It's very new. So
Yeah.
but they're proud.
But basically, the end of the story is you're helping people know their bodies better, have less pain, and be able to go about their lives in a happier, more settled way.
Wow,
Yeah.
that's a great explanation. Right? Yeah, completely. That's exactly right. We're all about function and returning to your quality of life.
Yeah. I find it interesting because I didn't think the parent question was going to be as like I thought they would be more supportive, and we have a lot of people on this podcast who do work in adult fields or whatever, where they're like, yeah, ultimately my parents are down for it now because I'm helping other people in this way. And you guys are literally helping people in a medical way that it's like, there's still this stigma because it's like with nudity and with people's pelvises and with people's sex lives.
So like my mom came to when I went to Pakistan in January, my mom came to my talk, and okay, so this is Pakistan, like taboo central. And I did a grand rounds lecture in a hospital setting. So internal medicine doctors, surgeons, and my mom was sleeping.
Yeah.
Like legit sleeping during my talk.
Okay.
In the same room? In the same room. She was watching me and I could see her sleeping. I mean, it was 8 a.m., but still, she was sleeping. And
no, that's when you're awake, Mom.
And I'm literally like, urinary incontinence, ejaculation, like saying words that maybe might wake her up. And my aunt's there, and like I'm trying to like get a rise out of some of the men, get some like just to say these words.
Yeah.
And I mean, I don't think they're not proud. I just think they don't know, and they're like, well, you're making money. I guess you're doing good.
Right,
People are getting better. I see things. You're publishing things. So, like, thumbs up.
Totally. it's more other people are reacting well, so it must be
It must be
good.
fine.
Yeah.
Yeah.
I feel like that's also a generation thing.
Yeah.
Like anything new, they're very skeptical.
I'm not
going to
say that our parents weren't a little.
What's a podcast?
What is a podcast? Yeah. And then, it's about cum. She's okay, Remy. But then it's the medical side. Well, okay, this is better.
Oh, you're on iTunes. I get it.
Oh, yeah. Yeah.
Well, so yesterday, my daughter's like, so I was like, guys, I have to do a podcast after work, so I'm going to be a little late. My daughter's like, what's a podcast? Oh, it's this thing. You know, it comes up. We were in the car, so I was like, it comes up on the car, and you can play it. They're like, can we listen? I was like, sure. They're like, but what's it about? I was like, pelvic pain. So we're not going to get it. I'm like, probably not. They're 5 and 7. So
cute.
But I think you could explain it to them. Hey,
Yeah.
there's this muscle that in some people gets really tight and it makes their butts and ginies and wieners hurt.
My daughter always says when we were going around in her class, all the parents came in and the kids were telling what their parents did for work. And my daughter stands up and says, my mom treats public pain. She gets people better, takes away their pain in public. Yeah, that's what I do.
So cute.
that is really cute.
I love them from afar. This has been so much fun. Where can everybody find you, your practice, your social media, if it's out there?
I am on Instagram at Dr. Tay Ahmed, Tay Ahmed, and then our office website is pelvicrehabilitation.com. Just have to spell it right.
Perfect.
And we also have an Instagram and Facebook for our pelvic rehabilitation medicine. So PRM, we have our own Instagram as well.
Is it just pelvic rehabilitation? I don't think there's a medicine on the
Instagram.
Instagram.
It's just pelvic rehabilitation.
Yeah.
Yes.
And then yours is Dr.
Allyson. But
Yeah.
yes. And our office, we're currently in Manhattan. So, look us up. Pelvic Rehabilitation Medicine in New York City.
And what about for people in other states? What should they just Google?
We're actually currently growing. We'll be in Miami in May, as
wonderful.
well as D.C. in May, Washington, D.C., Miami, and we are in New Jersey as well.
Cool.
So we are in other states.
Just like endometriosis, you're spreading.
Yes. We're spreading.
But in a nice way. Okay, perfect. I just have to ask this at the end of every sexual experience, which this has been. Tayyaba, did you finish?
Yes, I did.
Okay, amazing. Allyson, did you finish?
Yes, I did.
Perfect. Charlotte Casimir, did you finish?
I sure did. Did you, Remy?
I did. Thank you, everyone, for coming. And we'll see you next time on How Come. Goodbye.
Bye. Bye.
Yay.
It's not you, it's me. I try so hard to finish honestly. They say you'll know when you go all the way from A right down to O. Oh no, I think that I still got a ways to go. Oh, I'm sick of this and I have got to know. How come? How come? How come I can't achieve? How come I can't achieve? I'm rolling up my sleeves. I'm rolling up my sleeves. Oh baby, I believe these guests can help. 'Cause I can't do it by myself. I wanna jizz